Memory loss rarely begins with forgetting names. It often starts with signs no one suspects. These early changes can appear years before diagnosis. Doctors call this stage mild cognitive impairment, or MCI. At this stage, the brain begins to process information differently. These changes may be too subtle to notice immediately. Family members often assume these signs are normal aging. But the brain is already undergoing structural changes. Connections between neurons may weaken gradually. This affects how memories are formed and retrieved. The person may still function normally in daily life. This makes early decline difficult to recognize clinically. Standard tests may not detect subtle brain changes yet. However, the biological process may already be underway. Early awareness creates an opportunity for intervention. Recognizing subtle signs early may protect long-term brain health. The first cognitive change may not be memory, but attention. Focus allows the brain to encode new information clearly. When attention weakens, memories are never fully formed. This can appear as forgetfulness, but the cause begins earlier. The person may struggle to follow conversations fully. They may lose track of details quickly. Multitasking becomes noticeably more difficult. The brain's executive function begins to slow subtly. This region controls planning and sustained attention. Reduced activity weakens information processing efficiency. These changes may go unnoticed in routine settings. Standard memory tests may still appear normal. However, attention decline predicts future cognitive impairment. Early detection allows earlier protective strategies. Attention is often the first silent signal of brain aging. Getting lost in familiar places can begin years before diagnosis. This early sign involves the brain's navigation center. The hippocampus helps create mental maps of surroundings. Damage here disrupts spatial orientation. The person may hesitate in once familiar locations. They may take longer to recognize landmarks. Driving routes may suddenly feel unfamiliar. These changes often appear subtle at first. Family members may not recognize the pattern. Navigation relies on complex neural coordination. Early degeneration weakens these connections. This process may begin long before symptoms seem serious. Standard exams may not detect spatial decline easily. But spatial changes are strong predictors of memory disease. Early awareness can help protect independence longer. Struggling to find simple words may signal deeper brain changes. This often begins with occasional pauses during conversation. The person knows the meaning, but cannot retrieve the word quickly. This reflects slowed processing in language centers of the brain. The temporal lobe plays a key role in word retrieval. Neural connections here may weaken gradually. The person may substitute vague words instead. Sentences may become less specific over time. These changes often appear subtle initially. Many people dismiss this as normal aging. However, language decline can precede memory loss. Brain imaging often reveals early structural changes. Early detection allows earlier support strategies. Maintaining language activity supports brain resilience. Subtle language changes may be an early warning sign. Unexpected financial mistakes may be one of the earliest warning signs. Decision-making depends on the brain's frontal lobe. This region helps evaluate risk and consequences. Early decline weakens judgment subtly. The person may make choices they normally would avoid. They may trust unfamiliar callers or messages. Financial vulnerability can increase gradually. These changes often appear before memory symptoms. Family members may notice unusual decisions first. The individual may not recognize their own changes. Frontal lobe degeneration affects impulse control. This alters reasoning and planning abilities. Doctors may overlook these early behavioral signs. Recognizing judgment changes allows earlier protection. Subtle decision changes may signal early brain vulnerability. Subtle personality changes can appear before memory loss begins. Family members may notice emotional differences first. The person may become more withdrawn socially. They may lose interest in familiar activities. Mood changes may occur without clear explanation. These emotional shifts reflect brain chemistry changes. Neurotransmitters regulate mood and emotional stability. Early degeneration disrupts these delicate systems. This may alter emotional responses unexpectedly. The individual may not recognize these changes themselves. Doctors may attribute symptoms to stress or aging. However, emotional changes can signal brain vulnerability. Early support can help stabilize emotional health. Social engagement helps preserve brain function. Personality shifts may be among the earliest warning signs. Daily routines may quietly begin to break down over time. These tasks rely on procedural memory systems. Procedural memory controls familiar repeated actions. Early decline disrupts these automatic processes. The person may forget steps in common tasks. Cooking routines may become less organized. Medication schedules may become inconsistent. Personal habits may begin to change subtly. These disruptions often appear gradually. Family members may notice small differences first. The brain regions controlling routine begin to weaken. This affects automatic behavioral patterns. Routine breakdown often precedes serious memory loss. Early recognition helps preserve independence longer. Routine changes may signal early cognitive vulnerability. Poor sleep may silently accelerate early cognitive decline. The brain depends on deep sleep to restore itself. During deep sleep, the glymphatic system becomes active. This system clears metabolic waste from brain cells. Poor sleep reduces this natural cleansing process. Amyloid proteins may accumulate more quickly as a result. Sleep fragmentation becomes more common with age. Chronic insomnia increases inflammatory stress in the brain. This may worsen memory and attention performance. Daytime sleepiness can mask deeper cognitive changes. Doctors may focus on fatigue rather than brain health. However, sleep disruption is strongly linked to dementia risk. Improving sleep quality supports cognitive resilience. Regular sleep cycles strengthen neural repair mechanisms. Sleep may be one of the most overlooked brain protectors. Early cognitive decline often hides behind signs of normal aging. Many symptoms appear subtle and inconsistent at first. Patients may not report early cognitive changes clearly. Family members may overlook early warning signs. Standard screening tests focus on obvious memory loss. Subtle attention or judgment changes may go undetected. Early brain degeneration may not produce severe symptoms yet. Diagnostic thresholds often require measurable impairment. Early decline may fall below these thresholds. Time constraints may limit detailed cognitive evaluation. Symptoms may be attributed to stress or fatigue instead. Advanced imaging is not always performed early. Early biological changes remain invisible clinically. Awareness improves early recognition and intervention. Recognizing subtle signs allows earlier protection of brain health. Early awareness gives the brain its best chance to stay strong. Brain health depends on daily lifestyle choices. Physical activity improves blood flow to brain tissue. This supports neuron survival and repair. Mental stimulation strengthens neural connections. Learning new skills promotes brain plasticity. Social interaction protects emotional and cognitive health. Sleep quality remains essential for brain maintenance. Healthy nutrition supports long-term cognitive function. Regular medical checkups improve early detection. Early intervention may slow cognitive decline. Brain aging is influenced by multiple factors. Small daily habits create long-term brain protection. It is never too early to support cognitive health. Protecting brain health helps preserve independence and quality of life.